Hello everyone, once again another learning video, and today we're going to talk about apraxia. So apraxia, it's such a broad topic because there's not a lot of research talking about ataxia and PT. So we're just going to do our best to understand what apraxia is. Now, when we are going to perform something, a movement or whatever, there were some theories a long time ago that would say that we create on our brains different motor programs, and then when we are going to do something, our brain kind of retrieves that motor program to do something, right? So there are different theories that say, let's say if I learned the task of throwing, and my brain, every time I'm going to throw something, it kind of, throwing program, okay. So apraxia pretty much means that I don't really know how to do something, even though I can. So apraxia reflects an impairment of the storage and transformation of motor representations in the brain. There are several types of apraxia. Today we're just going to talk about two, the most common ones that you're going to hear, which is ideomotor and ideational apraxia. Now, ideational apraxia, I like to remember this one as I don't have any idea how to do this movement. So this is how I remember ideational idea. I don't have an idea on how to do a movement. So ideational apraxia was described by Liebman as a disruption of the space-time picture in which the idea of the movement itself is lost. So now, ideomotor apraxia, it's when the idea of the movement is intact, meaning I know how to do the movement. I have the idea on how to do the movement. But when someone tells me do it, I'm like, I don't know how to do the movement. Let's again go back to ideational apraxia. So this is a little bit more complex because these patients are often disabled and they struggle greatly with just carrying out basic activities of daily living. And this commonly develops in people with Alzheimer's disease, or people with the left hemispheric stroke. Ideational apraxia could be present. Now, ideomotor. So this is when I do have the idea, but if someone tells me to do it, I'm just probably not going to do it because I don't know. So ideomotor apraxia, again, this is a disorder of the production system, so patients display errors in the scaling, timing, and orientation of movements when asked to do the action. A good way to evaluate if our patients have ideomotor or ideomotor. Anyways, if you want to know if your patient has ideomotor apraxia, you basically have to ask them, like, show me how you would brush your teeth, or show me how you would comb your hair. And they might not be able to show you those actions. And a typical feature of ideomotor apraxia is that the patient's performance will improve if you give them the object that have just been asked to use or perform or things like that. Because there's an intact representation of the goal of that action, having that visual and tactile feedback associated with the natural use of an object or natural movement will improve the selection of limb posture and just coordination and, limb movements. So people with ideomotor apraxia are typically less disabled than someone with ideational apraxia. If we have ideomotor apraxia, we would consider demonstrating the correct way to do what we just asked them, and then asking the patient to imitate us. If they can see how it should be used, or in our case, we can do it like how we stand up, then they can still access that intact action production system, meaning that motor program, motor abilities, to produce a good imitation. If they have ideomotor apraxia, the patient might be unable to demonstrate the action because they have lost that semantic memory associated with the tool, the imaginary toothbrush or the imaginary scissors. So in general, demonstration, visual demonstration, some guidance, but more than anything, demonstration and kind of imitation will be very, very important for people with apraxia. Other types of treatment strategies described or cueing, guiding techniques include gestures, a picture of what you, let's say, want them to do. So in this case, I would guess it's like a picture of someone like standing up or holding a cup or something like that, and then mimic it for them and then asking them to imitate. So in this case, I would maybe minimize the verbal cues and just augment the gestures and the guidance and all just things with my hands, like that, the tactile cue and things like that. So those are your nuggets for apraxia. Very difficult topic, not very described in the literature, but we're trying hard, right? So I really hope you enjoyed this video, and I will see you next time.